In my lecture today, I want to show true regeneration is not the replacement of tissue. It is the restoration of biological communication.
Aging begins when cellular signaling becomes inefficient, when intercellular communication degrades, homeostatic feedback loops fail, and tissues lose coordinated response. This breakdown in signaling precedes visible aging and underpins functional decline across every organ system.
Most regenerative interventions do not directly rebuild tissue.
Their primary mechanism is modulation. Modulation of paracrine signaling, modulation of inflammatory and immune pathways, modulation of metabolic and mitochondrial function. Stem cells, platelet-derived therapies, and biologics do not function as structural replacements. They act as signaling mediators. They influence cellular behavior. They recalibrate inflammatory tone. They re-establish regenerative signaling gradients. NAD mice plays a critical role in cellular energy metabolism and DNA repair capacity, but it does not override dysregulated biology. Dr. Treacy will show this later. No regenerative intervention can compensate for chronic sleep deprivation, persistent psychological stress, metabolic dysfunction, or sustained inflammatory burden.
Regenerative medicine does not introduce intelligence into the system.
It enhances endogenous biological intelligence and supports repair mechanisms already present. It improves cellular responsiveness. It restores coordination across aging tissues.
It does not recreate youth, because youth is a developmental state.
It restores biological dialogue.
Remember biology first, mechanism before marketing, regeneration without illusion.